Yes?
Hi, Rita. Hazel, good to see you again. How are you doing?
It's been the longest few days of my life, waiting to find out what you have to tell me.
During your colonoscopy, we found 3 polyps. 2 of them were quite small, and I removed those. The lab report shows that those 2 smaller polyps were benign. That means they were not cancer. But here, I found a 3rd larger polyp I was unable to remove. I biopsied it, and it has cancer cells.
I have cancer.
Yes, in part of your colon. But there's some good news. I reviewed your CAT scan and your other test results, and it looks like we found your cancer early before it's had time to metastasize or spread to other parts of your body. We call that stage 1 cancer. Most stage 1 colon cancers are treated with just surgery.
Just surgery?
Yes.
You mean she may not need chemotherapy or radiation?
But I won't know for sure until after surgery.
Why not?
During your surgery, I'll remove the cancer from your colon and a little extra tissue on either side to make sure we get all the cancer. And I'll remove several lymph nodes. These are small glands near the colon to be sure the cancer hasn't spread. All the tissue I remove we'll send to the pathologist. After your surgery, when we get the pathology report back from the lab, your cancer will be discussed at tumor board.
What's that?
The hospital has a treatment planning process we call the tumor board. All the people involved in cancer care meet once a week to discuss the best treatment plan for you and other patients diagnosed with cancer.
It's like getting a lot of second opinions. Dr. Newman is there, and other experts, oncologists, the pathologists, social workers.
After the tumor board meets, we'll discuss whether chemotherapy or radiation, or quite possibly neither one, is recommended. But now, we need to schedule your surgery.
I don't want to get all cut up.
I'll make the smallest incision I can and still get all the cancer.
There goes my chance at being a bikini model. Will I be in pain after surgery?
Immediately after your surgery, we'll give you some medication to keep you comfortable. But you won't need all that much, and not for very long. You'll be out of the hospital in a few days.
Auntie, this isn't going to be nearly as hard as you think it is. A couple of days at the hospital, a week or so at my house to make sure that you're healing okay. A couple weeks recuperating at home, you'll be as good as new.
That's a long time, especially in the summer, during fishing.
I understand, but think of this surgery as a way to help you enjoy fishing and berry picking for many years to come. Talk to Rita and your other family members. Talk to your friends. We'll call you to schedule the surgery. We don't want the cancer to have time to spread to other parts of your body. What questions do you have? Well, if you think of anything, write it down so you can remember to ask.
I will.
Now, because you have colon cancer, your relatives are at higher risk. I'd like you to talk to Jake, our patient navigator, about that. Rita, you know where Jake's office is.
Sure.
Good. So we'll be calling you, okay?
Thank you, doctor.
You're very welcome.
Hi, I'm Jake. I'm the patient navigator.
I'm Hazel.
Please come have a seat. What could I do to help you?
I just been diagnosed with colon cancer. Dr. Newman said something about contacting my relatives.
It would be helpful if you let your family members know about your diagnosis. Colon cancer could sometimes run in families, so I'd like to get a list of your first-degree relatives.
This means your brothers and sisters, your mom and dad, your kids.
With your permission, I'll contact them and encourage them to come in for earlier and more frequent colon screenings.
Auntie, I'd rather know that I'm at risk than have something sneak up on me. The rest of the family would want to know too.
I guess they do need to know.
Here, I'll help you.
How did I get colon cancer? We never had cancer in our family.
We don't know all the reasons people get cancer, but what we do know is Alaska Natives have a higher rate of colon cancer than the general population. That's why screening is so important.
And if I had my screening done when I was supposed to, Dr. Newman could have removed those polyps before they became cancer.
I'd like you to consider talking to a friend of mine. Her name is Dinah. She had colon cancer surgery a few years ago.
I know her. She's a really neat lady. You'll like her.
Is it okay if I tell her you might stop by?
Yeah, that'll be okay.